Your feet are trying to tell you something. They're not just the foundation of your body, they're an early warning system that can reveal deadly diseases before any other symptom appears. Yet most people ignore their feet until it's too late. Today, I'm going to expose 6-foot symptoms that are secret signals your organs are failing, and the medical establishment doesn't want you to know about them. Because if you can read these warning signs correctly, you could prevent diabetes, heart failure, liver disease, and even kidney failure before they destroy your health. The truth is shocking. Your feet show the first signs of systematic disease because they're the furthest from your heart. When circulation fails, nerve damage begins, or your organs stop functioning properly, your feet feel it first. But here's where the medical system fails you. They treat each symptom separately instead of looking at your feet as a diagnostic window into your entire body's health. That swelling they dismiss as normal aging. It could be your heart crying for help. Those tingling sensations they call nothing serious. It might be your nerves dying from diabetes. The cold feet, you blame on poor circulation. It could signal life-threatening arterial disease. For decades, doctors have been trained to focus on isolated symptoms rather than understanding what your feet are really telling you about your systematic health. But breakthrough research from medical journals reveals the truth. Your feet are one of the most accurate predictors of serious health conditions. A study in the Merck manual shows that specific foot symptoms can indicate liver disease, kidney failure, heart problems, autoimmune conditions, and neurological disorders with remarkable accuracy. Today, I'm going to walk you through the 6 most critical foot warning signs and what they really mean for your health. Warning sign number 1. Bilateral foot swelling. If both of your feet are swelling symmetrically, this isn't just water retention, it's a red flag that your organs are failing. Medical research shows this type of swelling indicates kidney disease, where your kidneys can't filter properly, liver dysfunction, where your liver can't produce enough albumin, and heart failure, where your heart can't pump blood effectively. The swelling happens because these vital organs control fluid balance in your body. When they fail, fluid accumulates in your feet first because gravity pulls it to the lowest point. If you press your finger into the swollen area and it leaves an indent called pitting edema, seek medical attention immediately. Warning sign number 2. Firm, non-pitting swelling with cold fingers. This is different from regular swelling. If your feet and legs feel hard, don't indent when pressed, and you also experience cold, painful fingers, you could have systemic sclerosis. This autoimmune disease causes your connective tissues to harden and your blood vessels to malfunction. It's often accompanied by Raynaud's syndrome, where your fingers turn white or blue in cold temperatures. The Merck manual identifies this as a critical foot manifestation that requires immediate autoimmune evaluation. Warning sign number 3. Numbness and heel pain. If you're experiencing numbness, tingling, or pain at your ankle and heel, especially if you have chronic foot swelling, this could signal hypothyroidism. Your thyroid controls your metabolism, and when it slows down, it can cause nerve compression in your feet, fluid retention that worsens the compression, tarsal tunnel syndrome, where the nerve gets squeezed. This condition is often misdiagnosed as a simple foot problem when it's actually a sign your thyroid is failing. A warning sign number 4. Red dusky patches with blisters. If you notice red dark patches on the top of your feet with fluid-filled blisters, you could have necrolytic acral erythema, a rare skin condition linked to hepatitis C. This happens because liver dysfunction from hepatitis C causes zinc deficiency and protein malnutrition, which shows up as specific skin changes on your feet. Medical literature confirms this is one of the most reliable foot signs of liver disease. Warning sign number 5, sausage-like swollen toes. If your toes look like sausages, swollen, painful and deformed, this could indicate serious autoimmune conditions such as psoriatic arthritis, which is linked to psoriasis, reactive arthritis, which is triggered by infections and other inflammatory joint diseases. This condition, called dactylitis, happens when your immune system attacks your joints and tendons, causing entire digits to swell. It's often the first sign of these conditions before they spread to other joints in your body. A warning sign number 6, burning, tingling foot pain. Diabetic neuropathy is one of the most common and dangerous causes of foot problems. When your blood sugar stays elevated, it literally damages the nerves in your feet, causing burning sensations, tingling and numbness, sharp shooting pains, and loss of sensation. Here's the terrifying part. Once you lose feeling in your feet, you can develop wounds without knowing it. These wounds can become infected and lead to amputation. Studies show that 15% of diabetics will develop foot ulcers, and diabetic foot problems cause more hospital admissions than any other diabetic complication. But there are other foot symptoms that reveal additional serious conditions. Peripheral artery disease shows up as cold feet, shiny skin, hair loss on your legs, and slow healing wounds. This condition means your arteries are narrowing and could lead to a heart attack or stroke. Gout causes sudden severe pain and swelling in your big toe joint. While painful, it signals dangerous uric acid buildup that can damage your kidneys. Heel pain with Achilles tenderness could indicate spondyloarthropathies like ankylosing spondylitis, inflammatory diseases that attack your spine and joints. Even seemingly minor symptoms can be significant. Athlete's foot that keeps returning might signal diabetes, as high blood sugar creates the perfect environment for fungal infections. Slow healing cuts or wounds could indicate circulation problems or diabetes. Changes in toenail color or thickness might signal fungal infections, circulation issues, or nutritional deficiencies. The key is understanding that isolated foot problems are rarely just foot problems. Your feet are connected to every system in your body through circulation, nerves, and immune function. When you see these warning signs, don't just treat your feet, investigate what your body is trying to tell you about your overall health. Here's what you need to do. First, document any foot symptoms with photos and notes about when they occur and how they feel. Second, see a healthcare provider who understands the connection between foot symptoms and systematic disease. Third, ask for comprehensive testing based on your specific symptoms: blood sugar and A1C for diabetic neuropathy, thyroid function for swelling and numbness, kidney and liver function for bilateral edema, autoimmune markers for inflammatory conditions, and vascular studies for circulation problems. Fourth, don't let doctors dismiss your foot symptoms as normal aging or nothing serious. Your feet are speaking, and they could be saving your life. Remember, early detection is your best defense against serious disease. The symptoms I've shared today are backed by peer-reviewed medical research and published in respected journals like the Merck Manual. This isn't alternative medicine. This is evidence-based diagnosis that could prevent years of suffering and potentially save your life. If you found this information valuable, subscribe for more health insights that go beyond surface symptoms to reveal what your body is really telling you. This is Thrive Loop, where we decode your body's warning signs before it's too late. Take care of your feet, and they'll help you take care of your